When you think about a dental implant, it's a lot like building a house. You wouldn't dream of putting up the walls and the roof without first pouring a really solid foundation, right? Well, today we're going to get into the essential prep work, the foundation building that makes a successful implant possible, and we're basing it all on what the very latest science has to say.
So, are you considering a dental implant? I mean, it is the gold standard for replacing a missing tooth. It's this permanent solution that can look and feel totally natural. And you might think, okay, it's simple. They put in a post, add a crown, and that's it. But as we're about to see, it's almost never that straightforward.
Because before any of that can happen, your jawbone has to be absolutely ready to support that implant for years and years to come. And honestly, a lot of the time, it just isn't. Things like time, how the tooth was lost, and just your own anatomy can leave the bone too thin, too short, or way too close to other important things.
And that's where this term adjunctive surgery comes into play. It sounds complicated, but it's really just the clinical name for all the extra procedures a surgeon might need to do before or even during the implant placement, all to build up that perfect foundation. Think of it like the site prep before the construction crew shows up.
All right, so here's our game plan. We're going to walk through 4 of the most common challenges and the surgical solutions that are used. We'll start with what happens right after a tooth is pulled, then look at how you can rebuild bone that's been gone for a while, then we'll go upstairs to the upper jaw, and finally navigate a tricky situation in the lower jaw. Let's jump into that first challenge.
First step, saving the tooth socket. This is all about what you do in that critical window of time right after a tooth is lost.
See, the second a tooth is gone, your body kicks off this process called resorption. That bone that used to hold the tooth just starts to shrink away because, well, it doesn't have a job anymore. This is a huge deal for that super thin wall of bone on the cheek side, the buccal plate. If you lose that, placing an implant later gets a whole lot harder.
So the solution is something called ridge preservation. The idea is to get in there right away. It starts with taking the tooth out as gently as possible to save every bit of that fragile bone. Then, the socket gets a thorough cleaning. It's often filled with a bone graft material that acts like a placeholder. And then, critically, it's sealed up to protect everything while it heals.
And here's the key takeaway. This whole strategy, it really works. A huge 2022 review confirmed that sealing that socket leads to way less bone shrinkage. But what's fascinating is the how. It turns out that while sealing it is crucial, the research shows that no single material, whether it's a fancy collagen membrane or basically a medical-grade superglue, is consistently better than any other. It's the principle of sealing it that matters most, not the specific product.
Okay, but what if that step was missed? What if a tooth has been gone for years? Well, that brings us right to challenge number 2, having to rebuild a jawbone that's already shrunk. This is what we call an atrophic ridge. The bone has just gotten too narrow or it's not tall enough to securely anchor a dental implant. Trying to put an implant in there would be like trying to drive a big screw into a thin piece of drywall. It's just not going to hold.
The go-to fix for this is a procedure called guided bone regeneration, or GBR, and it's actually a really cool process. A surgeon will place bone graft material right where they need the new bone, and then they cover it with a special barrier. This barrier acts like a little construction tent. It creates a protected space, keeps out the wrong kind of cells, and lets your body's own bone-building cells move in and literally rebuild that foundation, brick by brick.
Now, what's really interesting here is seeing how technology is evolving. A brand new trial from 2024 compared 2 modern ways of making that tent. One was a custom 3D printed titanium mesh, and the other was a more traditional reinforced membrane. And the result? They both worked equally well. What that tells us is that success in this case depends more on the fundamental skill of the surgeon, the craftsmanship, than on which specific high-tech gadget they use. Okay, let's move on. We're going to head up to the upper jaw now, which has its own unique architectural problem, the low-hanging sinus.
So right above your upper back teeth are your maxillary sinuses. They're just air-filled pockets in your skull. When you lose those back teeth, 2 things can happen. The bone shrinks up from the bottom, and the sinus can actually expand down from the top. And what you're often left with is a paper-thin layer of bone between your mouth and that sinus cavity, way too little to hold an implant.
To fix this, surgeons do what's called a sinus lift. And there are really 2 main ways to go about it. The lateral window approach is where they make a small window on the side of your jaw. They can see the delicate sinus membrane and they gently lift it up. The transcrestal approach is a little less invasive. The surgeon lifts that same membrane indirectly by working up through the very hole they're already making for the implant. And surprise, surprise, the research points to a very familiar theme here. A massive 25-year review looked at all the different tools and techniques for that less invasive lift and found that they all have incredibly high implant survival rates. Once again, the evidence is screaming that success isn't about the specific tool in their hand, it's about the surgeon's experience and their good judgment in picking the right approach for that specific case.
All right, finally we get to what is probably the most delicate challenge of all: placing an implant in the lower jaw when there's a major nerve sitting right where you need to be.
When there's really severe bone loss in the lower back jaw, the main nerve down there, the one that gives feeling to your lower lip and chin, can end up sitting incredibly close to the surface. Trying to place an implant here is a big deal because you risk damaging that nerve, and that could lead to permanent numbness.
This slide really just lays out the delicate trade-offs that surgeons have to weigh. As you can see, there are two main options. With lateralization, the nerve is just gently nudged to the side. With transposition, it's lifted completely out of its little channel. And here's the key finding from a 2025 meta-analysis. While you can get temporary numbness with both, the less aggressive lateralization technique has a much lower risk of causing permanent nerve problems. It is a high-stakes procedure where it really seems like the gentler approach is the safer one.
So, we've looked at 4 pretty different challenges. After all that, what are the big recurring themes that the research keeps pointing us back to? Let's tie it all together. First, the fundamentals really matter. Protecting the healing process right from day one is just a fundamentally sound principle. The evidence is totally clear on this. Covering and sealing a tooth socket after it's been pulled consistently helps you save more bone for the future.
Second, biology and technique almost always win out over technology. When you're trying to rebuild bone, success doesn't come from having the newest, shiniest device. It comes from respecting the basic biological principles of healing and having really skillful surgical execution. It's more about being a master carpenter than just having a new power tool.
And finally, our third and maybe the most important theme of all. For these really complex procedures, the single biggest factor for success is the person holding the instruments. The research couldn't be clearer. The clinician's experience and their careful selection of who is a good candidate for the surgery, that is what truly ensures success and keeps risks to a minimum.
Which really leaves us with this one last thought to chew on. The science gives us the blueprints, it gives us the materials, but as the research shows again and again, it's the surgeon's judgment, their skill, and their experience, you could even call it their artistry, that actually builds that solid foundation. It kind of proves that in medicine's most intricate work, maybe the artist is just as important as the science.